It numbs you, a nightmare, a horrible disease. These are just a few of the ways people have described mental illness in their lives. Whether it's you, your child, or a friend, mental illness impacts all of us in the same ways, and that's why the Mind Space podcast is committed to uncovering mental illness and the impact it has.
Welcome to another session of the Mindspace podcast, hosted by me, Martin, Mark, and Debbie. The two other hosts are not going to be with us today. So the aim of this podcast is to increase awareness of mental health across the board. This is to, if you're not feeling the way you should, or probably you're out of mood more than you should have been, you've been a happy guy, or someone who has a person who's probably out of character. So we just try to give you so much information from so many of the sessions that we have been doing and we shall be doing more. And today we are here to discuss PTSD. I'm here today, I'm honored to be with Dr. Hazel. She comes in here as a specialist on PTSD. And I would like to just throw it to you now. What is this abbreviation and what does it mean?
Thank you so much for having me. If you'll allow me, I'll take my mask off.
I'm sure they will understand.
Yeah.
I was also wearing mine, but I had to remove it before I asked her.
Yeah, so like Martin said, my name is Hazel Muliro. I am a community psychologist. And like he said, our topic for today is PTSD, which stands for post-traumatic stress disorder. We are in the month of June,
Yes.
and June is Men's Mental Health Awareness Month, and it is also PTSD Awareness Month.
So just before you go on there, what do you mean Men's Mental Health Month? You mean the other months are for women?
No.
So we only get 1 month where our minds are taken care of.
No.
Yeah.
So May
Yeah.
is Mental Health Awareness Month worldwide.
Okay.
The month of June is Men's Mental Health Awareness Month because, as you may know, we live in a patriarchal society, and men's needs, especially in terms of their mental health, are not looked after as well.
So we are always left out.
Yes, by the society that you created, yes.
That week? Okay.
Yeah,
That's good.
the patriarchal society.
Nice.
It puts you on a pedestal. It expects so much of you. You don't cry. You're a man. You don't do this. You're not supposed to do this. So this month is there to create special awareness on issues that affect you.
Okay.
Yeah.
And I think on behalf of the men, I want to say we are honored to get the 1 month to take care of us. So you mentioned PTSD. You already given it in full, which is a post-traumatic stress disorder. So in a very simple layman's language, what is this?
So post-traumatic stress disorder, or PTSD,
Yes.
as we will call it, is simply a mental illness or disorder which is characterized by the failure for you to recover from a traumatic experience, or failure to recover from something that is I'm so sorry. Post-traumatic disorder is simply a mental disorder or illness which is characterized by your failure to recover from a traumatic experience.
Oh, yeah.
Yeah.
So traumatic experience meaning what? So if for example I poured a glass of wine on my trouser, can that be traumatic to me, or is there specific actions that need to happen? Or it's variant from person to person? I mean, I don't understand what I want you to go into the depths of that. Like, is there specific amounts of actions that, like in terms of effect, if say someone slapped me, if I forgot my stockings at home and then I have to wear them, can that cause trauma to me? And I think maybe before you go, I always hear people say I'm traumatic. I mean, offline we've been discussing. Many of us have been on board accidents. So is that trauma? Is that also going to turn into PTSD? Is that what you say? Because you said if you can't recover.
Yes.
So how does that relate to some of these things that I just mentioned? Because in a way you can still call them traumatic.
Okay.
Yeah.
So I'm very glad that you asked this question the way that you did. So we do experience many traumatic things over a period of our lives. everyone has at least experienced one traumatic experience. But PTSD, post-traumatic stress disorder, means that this person has suffered this ordeal or experienced this trauma, and they have failed to quote unquote get over it, like how people like to say, oh, you'll get over it, or let's go here, or let's do this, you'll get over it. So traumatic experiences vary, and there are many. You gave an example of spilling something on yourself. So we wouldn't classify that as traumatic, but again, I think one thing I should say before we go far is I always encourage someone to see a mental health professional. It's very important not to self-diagnose, as is the case of physical illness.
Also, I can't just throw around trauma.
Yes, you can maybe perhaps suspect that that's what you may be going through.
It could be a shaming, because shame can cause so many things to the body.
Yeah.
Because you could see an event as simple as a wine bottle pouring on my trouser, but maybe I'm one of those people that needs to be perfect in everything I do. And now I'm in a couple of friends of mine, probably a party or an interview, and then I hit things. And in itself, in as simple as it looks, but the effect on me.
So for this specific scenario you're giving, I wouldn't necessarily assume you have PTSD. I would assume it is either a trigger, perhaps the way the bottle spilled has triggered you and made you remember something traumatic, or that would most likely, I would assume, if the stain is disturbing you, it would be most likely an anxiety disorder, perhaps. Okay. You have OCD. That's a different topic. Okay. So as I was saying, there are many traumatic events that we go through. And again, I would like to say individuals vary, and people are not a monolith. We are different, we're diverse, we have different things that are...
Each one of us is a variant.
Yes, we're not one way.
There's no...
Yeah, so, and traumatic experiences can vary, like we said, from an accident. Like a border accident could traumatize someone. And like we were saying before we were on the air, it's very important. I believe so much in preventative medicine. If someone perhaps goes through an accident or they witness combat, like war. Yeah, or for instance, as we may know the health state of our country, with what happened towards the election and the shooting.
Oh yeah, the guys that were running around in
yes,
town,
some of them may manifest symptoms of PTSD over time because they perhaps have not sought help for the trauma, what they witnessed. They saw people getting shot. Nowadays, if even a tire bursts, people are alert. They're like, oh my God, don't tell me it has started again. I was downtown last time and someone's tire burst and people were
almost running away because they thought maybe...
So right now, that is a symptom that they went through something traumatic, and if they don't seek help or if they don't do anything to...
So I'm not allowed to be scared first time?
You are allowed to be scared. That is a normal response.
If the tire bursts close to me, I mean...
That is a normal response to what happened downtown. Yeah. But like I said, if we don't receive help, then it will prolong and eventually manifest itself as post-traumatic stress disorder. And this disorder affects people's everyday living.
Okay, so now that you mentioned that, I would like us to go into the indicators now. Now, like you said, it could be my first time. The tires busted. I guess it's just a jerk, right? A loud sound. And I probably just want to turn around and see if it's coming my way. So it looks like I'm running away. But then there's another one who probably, as you said, is relating this incident to something that happened to them.
Yes.
So what are some of the indicators that people should really look out for? Say, because it's one thing to jack after a car tire, and then every other thing that falls in the house, I have a person who keeps on, it's like they overreact almost to every other thing. So what are some of the indicators that we need to look out for and probably start to think in a certain direction going into the PTSD?
Okay, so some of the indicators, like we've put it, or the causes or signs and symptoms that will let us know someone may or may not have PTSD. Again, stressing that you have to see a mental health professional to diagnose you. They can manifest themselves in behavior, like you said. Yes. They are unsettled, they're restless, they're hypersensitive, they're irritable. Yeah. And then they can also manifest themselves psychologically. So they have fear, they're constantly afraid, they have severe anxiety, they're very mistrustful, you know. The other way it can manifest itself is in our moods and also in our sleep patterns. So if someone can't sleep and then they're having nightmares, or they have a disturbed sleep pattern, so they sleep for 2 hours, then they get up.
So you mean before they were sleeping just fine?
Yes.
And now all of a sudden
they can't sleep at all, or they can't sleep well, or they're having nightmares and terrible flashbacks.
Okay.
Yeah,
so by
about
any
the
chance,
event.
can these same reactions be for just, you know what I mean? Like, there's people who do sleep, just the body reaction.
Okay.
There is no traumatizing event that happened to them.
Yeah.
It's just simple body, probably the body is wearing out of something, or they've been thinking too much, or they've been pushing themselves too much, and now the body is used to staying awake. And, you know, like, how do you relate these two? And then,
so I
you
think
can easily misdiagnose someone who's just a natural reactor.
So I think one thing that I should point out is mental health professionals are better equipped than the everyday person to identify what is a normal response, what is a prolonged response, what is most likely to be sickness, and what is not most likely to be sickness. Yes. And also, usually any change in behavior or change in the norm are always indicators that something is wrong. It doesn't have to be a mental disorder like PTSD. It could even just be that your mental health is suffering. Again, I would love to put it in terms of physical illness. It's not all the time that we have fever, malaria, but then usually it's just flu or fatigue.
Sometimes, yeah.
It's just fatigue, but it looks like malaria, which means if you give yourself the weekend off, you don't go out, you sleep, you rest, you eat well, maybe at work you don't get access to good food, after the 2 days you're back in good health. Yeah. So that's the same with mental illness, or when you feel mentally unwell. Sometimes symptoms manifest themselves, and it doesn't necessarily mean that it's something like PTSD. It may just be that you are unwell. Again, why I would advise someone to see a mental health professional and to talk to them, because we have a criteria that we follow in order for us to come to the conclusion that, you know what, perhaps you have PTSD, or it's actually an anxiety disorder.
Is made on how you adapt these patterns to come up to.
Yes, it's never one thing. Okay. Yeah, usually we follow a manual, the the DMS, or we have a criteria that we follow, because, like I said, we're well versed, better than the average person, to tell if someone is unwell.
So now that you mentioned that, brings me to another interesting question. So, how do I know that I need to see a specialist? I'm a tough guy, you know. I've had two.
I'm so glad you said that. You're a tough guy, which is why we have Men's Mental Health Awareness Month.
Oh, this month is ours.
Yeah, okay.
We are grateful for 1 month in the year. So how do I know? I mean, I've recovered from many accidents. I mean,
so one thing I would love to encourage people is the same way, and Ugandans, we're so good about looking after our physical health. Yeah. Ugandans, we know how to look after our bodies. We can see malaria from a mile away. We can see flu from a mile away.
Like it's coming.
And then we've suffered with pandemics such as Ebola. So we're so cautious. Cholera, typhoid. These are things we have in our community.
Because they've been around.
Yes. So we are so good at looking after our physical health. Mental health and physical health exist together. There is no physical health without mental health. So the moment you don't feel well, the moment you don't feel your best self.
But by physical, you mean?
Physical health in terms of diseases that manifest on our bodies,
malaria,
you feel fine. Okay. So that is the same with your mental well-being. The moment you don't feel your best self, I would encourage someone to see a mental health professional. It doesn't always, I think the stigma around therapy and counseling is that someone has to be the extreme version that we see a lot on the street. For instance,
yeah, because if you go early, you're probably a softie. Yeah?
No, you're not a softie, you're unwell. Do we not know people who go to the clinic for flu? And we know other people who will bear the brunt for a week.
Clinic for flu. They probably say, I did not feel so well. Because if you say you went to the clinic, in of course, general society, as I mentioned, we're like, you guys, you know, what's up?
There are people I know who go to the clinic because flu, it's really tough on them, and they don't want to go through gruesome 3 days. They'd rather go and take a flu shot.
Okay, that's news to me.
So we need to adapt these things, not just in terms of our physical health, but our mental health, to identify that we're not well, and prevent it getting farther than it should be. Yeah.
Okay, but of course there are other factors that come into that. There's also the cost, the stigma you mentioned, and
Yes.
also maybe the awareness.
Okay.
So all that is, those three
Yeah.
moving parts are very hard to equal.
Yes. So I understand that, especially in terms of awareness. I'm very glad that now we're having the conversation more and more. That is going to change. There's so many resources out there. I mean, mindful conversations, which is something I started about 2 years ago. We now have these podcasts and different platforms and resources creating awareness on mental health and mental health issues. We also, like you said, in terms of the stigma, as we create awareness, we are fighting the stigma. We are. And stigma is not something that will be just, we'll snap our fingers and it ends.
Something
Because
that comes over time.
with it's almost coming to 25 years of us battling HIV and AIDS, but there's still a
There's still
stigma
people there
around it.
suffering,
But
yeah.
there's been progress as well.
True.
Yeah, then like we said, you said something about the cost. Yes, therapy is expensive.
It's very expensive.
And not to mention mental health professionals who are practicing are also not that many.
Oh, yeah.
Yeah.
Why is that so? Or is there maybe just before we go ahead?
Well,
why are they so few? We don't have enough.
we do have
minds?
mental health professionals. We do have brilliant people. Have you met Ugandans?
Well, I have,
We
but
have-
I'm wondering why we don't have
Yeah,
so
we
many of
have
those.
them, but maybe some are not practicing for various reasons. We know that we're in a
Well,
country with a
there's
very
no
high
customers
unemployment
because they're not
rate.
coming.
I personally practice, but I don't earn from this. I do the work for free because that's my calling. That's something I'm interested in and passionate about. And I have another source of income. But if unfortunately I was put in a corner where I had to stop practicing for a bit in order to survive, that's one less psychologist doing the work. So we have a country with a high unemployment rate. We still have a lot of work to do with regards to awareness. So people are suffering at home.
So
They
you
don't
mean
want
all
to
those
seek help.
conditions create some
All
sort
those
of-
factors coming together is perhaps why we feel that there's no treatment, there are no psychologists, because they're there.
Okay.
Yeah.
Interesting. Now, I would want us to go into the discussion of, you say, when you don't feel yourself, probably seek the help of a doctor. So what happens, because this is the majority of the population in Uganda, what happens if I don't see a doctor? If I have PTSD, probably not yet diagnosed that, like factually, but I have it,
Yes.
I don't know. What will I suffer?
Okay.
What will the people around me go through? What happens if I don't come and see you, a
Okay.
specialist?
So, again, like is in the case of physical illness, if we don't seek treatment, then our sickness just keeps getting worse and worse and worse.
Yes.
So if a person does have PTSD and they've not been diagnosed, they will...
They're just living with it. But
They're
it won't
just
kill you,
living
I
with
don't
it.
think, not
So
yet.
it will affect their life, their day-to-day life, all aspects of their life. It will affect their relationships, romantic,
How
platonic.
exactly? Give me two events.
Okay. As we mentioned in some of the symptoms and signs, it manifests itself in a psychological way, mood, sleep patterns, behavioral changes. Can you imagine your partner? You don't sleep the whole night because she's having night terrors. She's just, she can't sleep. She's just screaming on top of her lungs. Then you wake her up, you give her water,
The
you
kids
go
are
back to
scared
bed
downstairs. They're
again.
like, "What's
So
wrong
it
with
would
daddy?"
affect the day-to-day life. And if she doesn't get enough sleep, she can't have a normal job. She's always tired at work. She can't concentrate full time.
So I can imagine this not sleeping.
Exactly.
Takes its toll on the body.
It takes
which
a
can
toll
lead-
on the mind. It takes a toll of everyone around you. Then imagine how it'll affect their co-workers because they're now irritable. Their mood is changing.
You're probably shouting at everything.
Yes, if they delay in responding to an email, their initial reaction is to, don't tell me, you think I don't know how to do my job, are you the one who hired me?
don't tell me
So
how to do
it
this
will
and that.
manifest itself until help is provided. Yes.
So in very simple terms, what you're saying is that if you don't see a specialist, it's going to lead you on a downhill road.
I think another thing I should say is I would encourage you not to always see a specialist at the start because, like we said, you can't diagnose yourself.
Is there a certain period of time through which I should wait from when I start getting these mixed
I
up
would
feelings?
advise anyone who does not feel their best self to see a therapist or
Because it
mental
could
health
be a mood.
professional.
I may feel low
Yes,
for
even
an hour.
that mood. No,
1 hour.
for an hour,
Yeah.
again, as is the case of physical illness, if you get a cold because the Kulambiro road is dusty and you sneeze for 2 hours, that doesn't mean you have flu. It's just a
Yes,
allergic reaction to the fact that you're on a border on such a long period of time in such a
30 minutes,
dusty
that's why
road.
you were already
So if you feel that kind of mood in an hour, that's sort of an indicator that maybe your mental health is suffering. If it happens for 1 hour, 2 hours, and it over a period of like 2 weeks, a week, then there is an issue.
Okay.
Yes.
And the long-term effects of this would be what? The children suffer the same?
Yes, of course, people around you
Probably
suffer.
what
All
people-
aspects of your life suffer. Your career, your interactions with people, with your loved ones, your day-to-day life. You're not
Because no one can live
operating
with it.
normally.
No one can live.
You
Are
may
there any
also-
anger issues in this that come up? I don't
Of course, like I said, one of the symptoms is irritability. So if you're irritable, you snap at people.
know. There would be like void rage sessions and
Yeah. You could just
you
get
burst out
angry
at
and
people.
yeah.
Okay. Is there any sense of this developing into depression?
Oh yes, there is a link between depression and anxiety
So this is
with
a highway?
PTSD.
If you don't
Not a highway,
Yeah.
but there is a connection with the sickness. So someone with depression could also potentially have PTSD, and that's why they've developed, say, clinical depression. Then someone who has PTSD could also suffer depression because perhaps now they can't sleep during the night. Maybe for example, whatever traumatic experience they suffered happened at night. They can't sleep at night and they're scared to sleep because they have night terrors and nightmares. So they try to sleep during the day. So they develop depression. They isolate themselves. They don't want to go to work. They don't want to leave the house. So there is a link because one could cause the other. Yeah. The same way we know I love to relate mental illness and mental disorders with physical illness because for that one we are very familiar with it. So the way we know that if you have a flu and you don't treat yourself and you just continue, yes, your immunity could help you this time and bounce back, but another time it could go to be more
find
than
you
flu.
weak.
Yes, we'll find you weak. You develop a fever. You get like a serious headache.
So when you mention depression, I would like to go through the extreme. There will be suicidal thoughts
Yes.
if you don't get this.
Yes, because you
Specialist.
exactly. Again, as I was saying, in terms of a specialist, I would encourage people as much as possible, as we're still on this journey of self-awareness, for people to not just see specialists, but to see even doctors. People in the medical field have a lot of resources and help they can offer us. They really can.
But at a cost.
Because yes, at a cost, but if you have a doctor friend or a doctor you usually go to who is cheaper, and you talk to them, because they are equipped with some skills to help you, they know a colleague who can help you. And if you're referred, and let's say they say, I know this patient of mine, they suffer a lot with, let's say, flu, but this time they came to me that their mental health is suffering.
Yeah.
Please, can you give them a little discount? Because I know
Yes.
this person. So I would encourage people to see not just mental health professionals, but speak to your doctor, speak to your counselor, because some of them have these resources.
Also, maybe before you go, we have a culture here in Eugene, Africa, specifically, of course, here where we are in Eugene. People don't have doctors. When I get sick is when I look for one. I probably go to the nearest. So I don't know what you have to say about that.
So again, things
Because when you
like
say go and see a doctor, there's a clinic
Yes.
right outside here.
yes, and I'm very glad that also I've noticed in clinics, at least in the big health centers like the health center 3s and bigger hospitals, they've now adapted. They now have counseling services. Even if it's just for like 2 days in a week, I want you to pay attention.
This
If you're ever in a
specialist comes,
hospital,
yes, there's also
there's
charts.
that notice board, yeah.
There's a chat.
So they've identified the need because people went and talked to the doctor. They said, but doctor, I'm also struggling with this. Doctor, Sulabubi.
Sulabubi,
And then,
Sebaka.
because even when you come to me as a mental health professional and I suspect that you have PTSD, I may recommend that we see a physician to rule out any physical illness
Leading up to
before I come to my final conclusion that, this person has PTSD, before I diagnose you. So mental health and physical health are interlinked. Yeah, that's why I know, I encourage people to reach out to us at Mindful Conversations, Akonka, Uganda. There is the Mind Lab, there's Strong Minds.
So
but
you
if
mean there
someone,
is NGOs that
yes, there are
set out-
organizations, there are people here who are now doing the work. But if someone
Interesting.
can't
How
reach out to
does
us,
someone reach out to them? You
Okay.
say reach them, but it's not as simple.
okay. So
How do
for Mindful Conversations, we are mostly online based. You can reach us on our Twitter and our Instagram, which is @MentallyAwareUG, or you can reach out to me. I'm very active. I'm somewhat active on social media. My handle is Hazel_Muliro.
I'm sure we shall have that displayed somewhere. on the screen,
Yes,
so,
yes.
Producer will have
As
to put
well, you can just Google Mental Health Uganda or Counseling Uganda or Therapy Uganda, and you will see some resources pop up. But the reason why I encourage people to go to who they know is, as much as someone could say, you know what, I've ever watched a podcast and there was this girl called Hazel, what if I'm unavailable? Or what if perhaps I don't answer the phone
So
when you
when
need
they
the
go into
help?
Google, they put Hazel.
No, they can put in Mental Health Uganda or Therapist Uganda or what do I do when I feel depressed? And there are resources that will pop up. We will pop up. There are very many lovely ladies like Dr. Elizabeth Musoke. She will pop up probably among the top.
Who's this lady?
Very lovely psychologist, clinical psychologist. I want to be like her when I grow up.
Okay, that's good. So I know we already jumped to that before we would have, but then going back to PTSD, I wanted to ask you, how common is this condition in our society, in Uganda here?
Okay.
I mean, to me, PTSD. I've never had anyone, nor have I seen anything. I just read about it. I probably get traumatized too, and I want to use the abbreviation to sound fancy. So, but how common? And in that, I also want to take you back to how to what situations usually bring this trauma. In specific, is there like losing someone? Is there accident? You already mentioned war, but are there any other common?
Yes.
So, how common is this condition here? And what do people need to look out for in that? I want us to go in a little bit of depth in that.
Okay. So PTSD is actually more common than we think. And like you said, if we identify some of the causes and the risk factors.
Like in Uganda, there's been no war. Okay, there's been flashes of, but no serious war.
Okay, so I think another thing I should kind of mention is trauma, away from post-traumatic stress disorder, PTSD, can be inherited. So many of us, yes.
When you say inherited, how? Like interest into DNA?
so many of, no, not DNA, but so many of us, our parents saw another president, correct? Which means they saw me. If you know your history, you know what that means. So you may understand why your parent votes the way that they vote. They don't want to experience what they saw. So if they raise you while making you aware of, before this person came into power, there was this.
So they pass it on in that sense.
Exactly. In a sense of, we're scared of what could happen again.
In the upbringing, you pick up on those fears from the parents.
Exactly.
And in turn, you become the same product.
Yes. So aside from PTSD, there are so many other factors, risk factors that could expose us to this. That's why I say PTSD is more common than we think. We know that our country has one of the highest rates of gender-based violence and sexual assault and rape, and we have one of the highest numbers of when rape and sexual assault is not.
Interesting there. What you're talking about. So you mean there is also physical activities or damages that can, apart from the usual accidents and all, is there?
Yes.
When you say rape, for example, you said rape.
Yes, PTSD can develop from rape.
So another person can give you.
No, I'm saying
someone
who is a victim of rape or sexual assault could develop PTSD.
And also domestic.
Yes, gender-based violence. If someone is abused, why I would love to stress the need for preventative medicine, it is important for us to help them there and then in order to avoid them from suffering from PTSD, because it manifests itself usually later on.
Because for me, I would say they're just not happy. It does not happen in your marriage or...
Gender-based violence is not unhappiness. Someone is being abused.
Okay.
Gender-based violence, violence, it's literally in the word.
I know what you mean.
Unhappiness, yes, violence can cause unhappiness.
Because people always mistreat each other. So...
But what mistreatment...
I mean, when you say abuse...
Abuse is physical, emotional, and psychological. If your partner is constantly belittled, but that's not healthy for you. That's not good for you. You can choose to stay in that situation. You can choose to see it as a norm, but it's not good for you and it's affecting you, whether you like it or not.
Okay, so if you say it like that, then almost everyone is susceptible to this PTSD.
Yes, that is why I would encourage someone who doesn't feel well or is in a vulnerable state to see a mental health professional. Because like you said, I think I have a problem with you saying that's how relationships are. Not all relationships
No,
are toxic or
I meant
abusive.
you are just not happy in your relationship.
Being unhappy doesn't mean you were abused.
But you said emotionally, physical,
Yes, it can be emotional, it can be physical, it can be both.
and all of this can lead to PTSD.
Yes, if they are not untreated or not addressed. If someone is abused, let's say over a period of 5-year relationship, and then they finally exit the relationship and they think, oh, because I'm not there anymore, it's
They'll not
handled,
be the same.
it could manifest itself later
And
on.
the next probably
Even when you're still single, you could fail to partner again because you're too scared.
flashbacks
So now
that
it's
you mentioned.
affecting that aspect of your life, your romantic relationships.
It's
You
changed.
can't give anyone else a chance, so you may need help.
Okay.
Yes.
Understood. So, I talked about grief. You talked about physical and emotional violence. Grief, can it?
Yes. So grief and loss are
Yes.
another traumatic experience that can lead to PTSD. If we don't resolve or process our feelings when it comes to loss and grief and losing something or someone, then over a period of time, it could come as post-traumatic stress disorder. Yeah.
Because everyone loses someone at one point.
Yeah.
So you try to say almost everyone needs to get help from a specialist.
Post-traumatic stress disorder can happen to anyone, but it doesn't happen to everyone. For another person, if they don't resolve or process their feelings of grief or loss or what happened to them, they could, for instance, suffer clinical depression instead.
Oh.
Yeah. Again, which is why I encourage people, if you don't feel well, as is the case of physical illness, see someone. See a mental health professional, see a counselor, see a therapist, because you can treat yourself. And that's another issue we have in our society, Ugandans. We think we can treat ourselves. The moment they have a sore throat, and ninaka fever,
I go and choose some
genda
Nemo.
ku pharmacy ogule all this, you
Or
know?
even Nemo, I self-medicate on herbs. all
Exactly.
the time.
Until it persists and you go to a doctor and perhaps the doctor says, what are you taking? You should have come last week. Because guno musujja ina malaria plus ne no typhoid. So I would encourage people not to diagnose themselves, see someone. And I know it's very difficult in the society that we're in, that it's not normalized. We see it like it's a waste of time. But if you
Waste of time, waste of resource. I
But
could go
if
there
you-
and I still have the flu.
But
I'm
if you know
self-medicated.
that you don't feel your best, it takes nothing from you. You're looking after yourself. We should adopt the culture of loving ourselves and having a lot of self-awareness and self-care. Because when we feel sad, especially in this drinking culture of Kampala, what's the next thing?
When
You
say
call the
drinking, you
boys.
mean
Alcohol. They're going to
Alcohol
call the
consumption.
boys. Yes, they're going to say, let me go out. Man, I'm not feeling my best.
Yeah.
Our work is stressful. Let's
get the
go
hype.
out. So if you can pop
Hype
your
out.
Jameson bottle, you can invest in a therapy session. Just one. It can go a long way.
Because I think it feels like speedy to many, and many, especially the men, and in fact, all the genders, people don't like to talk about their problems.
Yes.
People choose to conceal things within, and probably wait to heal, because probably they did before in a related kind of situation.
But then we have to remember that if it worked one time, again, like the example I gave you of flu, you can get flu and then it gets better, but next time flu can put you down because your body, you've not been giving it a chance. So yes, you may go through something and you get over it, because also, again, I think I want to point out, when I say drinking alcohol I don't mean it in a bad way. Because when you drink, usually you drink to socialize.
Yes.
And having a sense of community and a support system is good for you. So the first thing you go through, you may say, let me go out with friends, hang out with friends, let's go for a trip. So from a trip, you rest, you socialize, you feel better. But how long will that last? Because next time something else will happen. The trip may not work. Hanging out with friends will not work. You need to see a mental health professional. And there is no shame in it.
Is there no?
There is no shame in wanting help.
In discussing your problems.
Because this is even better. Because the shame people seek from asking for help is that how will their friends look at them.
Well,
But with a mental health professional, I don't know you. That's literally my job to come here and help you. So what's the shame in that?
Thanks for that, Hazel. So let's now jump into the final section of this conversation. Is how do we treat PTSD? In what ways? Is it even possible?
Yes, very possible.
Oh, yeah.
Mental illness is treatable, just like physical illness. Yeah. And when you have a mental, if you're diagnosed with a mental illness, say PTSD, you can live well with it and it's curable. Again, that's why you need to see a mental health professional. So for treatment, once you're diagnosed, your mental health professional, psychologist, therapist, psychiatrist will definitely come up with a treatment plan, which usually involves talk therapy, and they, again, not to go too technical, whatever technique
talk therapy meaning
therapy where you sit down with your counselor, with the therapist, and you talk. So the therapist will choose what, based off what they have assessed from, say, an initial session, what therapeutic technique to apply to help you feel better.
Because they are different. This conversation is different from any other you can have with your friend.
Yes.
Because then I would have asked you that, how different is this if I have my Hazel, you're my friend?
Yes, and you can come to me. Mental health professionals are equipped with different skills and experience and knowledge that helps us better approach. So we're talking, yes, but we're not really just talking for the purpose of you opening up and getting a listening ear. I am going to apply certain skills, some techniques I've learned to help also equip you with the same skills to lead a good and happy life despite this illness. Yeah.
So the other one was, you say talk therapy.
So talk therapy or therapy is the main treatment that will be offered to you. Maybe in some cases, based off what your therapist has seen, they may advise that, let's probably bring in another diagnostician and give you some medicine, maybe.
So it can get...
It's possible.
And then for this medicine is working how?
So it depends. For instance, if we identify that you have PTSD and then it has triggered anxiety, like severe generalized anxiety, it's crippling, you can't even leave your house, or every time you hear a sound, you're in the house, it's affecting you. I may contact a colleague, a psychiatrist, and say, okay, I have this patient, this and this. I think they could benefit for maybe medicine and talk therapy for 2 months, then we see how that goes. Again, as is the case of physical illness, sometimes you go to the doctor and the first thing they prescribe, we feel better. We finish the dose and that's it. But sometimes you go and the first dose doesn't work. You go back, you say, I felt better for 2 days, but now I'm feeling bad again. Back. So then they'll say, let's go to the lab. Then they'll say...
So this blood checking is checking for what? Is there like...
So for a doctor, I'm saying in terms of physical illness, I'm giving an example. That is usually the procedure. Then they'll say, we've checked your blood again, this and this, we've upped your dosage or we've changed the medicine. So a mental health professional may, depending on what they have assessed and learnt from the session, decide that perhaps they should bring in someone. Because usually the medication is not lifelong or like a full term, like, you're going to take the medicine forever. So they may say, you know what, maybe they'll benefit from 2 months of them being on this as well as this talk therapy. And then after that, we keep assessing, how are you feeling? Is it getting better? Or maybe the medication is now bringing other symptoms that are undesirable. And maybe we reduce the dosage or increase the dosage or take it off completely. So mental health professionals, like I said, we are equipped with the skills to help treat you. You can't understand it in one session, the same way you don't know everything about malaria. I have had malaria all my life, and I know
what you've interacted with.
Exactly. I know that if I have malaria, for me, my symptoms are like this usually, but another time it could manifest differently.
Okay. So then now, another situation that causes stigma is this step to start taking medicine. There is always this talk around,
no. So
you're going to be swallowing if you don't, problems.
Okay, so I think I personally, as Hazel and as a mental health professional, believe so much in preventative medicine. If people seek help early enough, or as soon as they feel unwell, then talk therapy can help them. Now, in cases where someone may need medication, that doesn't mean that you are quote-unquote a gone case. It just means you need a little extra something. Because if we think about it, mental illness or your mental well-being not being fine is an indicator that the chemicals in your brain perhaps are not doing what they're supposed to do. Yes, it's not doing what it's supposed to do. So having medicine is just helping. you know. And there shouldn't be this negative connotation with swallowing medicine. How come you can swallow medicine you can swallow your vitamins, or you can take your coartem in peace? Medicine isn't a bad thing. It doesn't mean that you're extreme or you are a gone case. It's just medicine to help you feel better, because we get sick, our bodies get sick, and the brain is part of the body, so it's also going to get sick.
Oh yeah, it wears out as we live day by day.
Yeah, it's going to get sick because it's part of the body. That's a fact.
Okay. So again, I know you had already talked about this. So you said now that we have reached this point of how to treat it, we can again go on how does someone reach out for help.
Yes.
So we can give it to the listeners. What do they do?
Okay.
And then we can also give them the different NGOs that you mentioned earlier.
Yeah. So I would advise anyone who is struggling with their mental health, or in this case suspects that they have PTSD, I would advise them to reach out to someone who they consider a support system. It is very, very important.
Support system?
A support system, or people in our lives. It could be a friend, a boyfriend, a sibling, a parent, a guardian, an aunt. There are people in our lives who we have identified as our people.
They're on your team.
They're on your side.
Yes.
So those people are who we would term as support systems. Okay. That is the best approach. The moment you feel like you're not feeling fine, because it's very good that we reaffirm people who are struggling with their mental health, is to reach out to your support system. Now, if, for instance, you're in a space where, because usually people who are struggling with their mental health, they don't want to be a burden.
Yeah, because you probably think that you're going to carry your problems and take them.
Exactly. So if in that case, or if, let us say, you don't know who to trust with such a problem, I would advise you, there's so many resources that are now available.
In Uganda here?
Yes, in Uganda.
Okay.
So like I said, I started Mindful Conversations, which is at Mentally Aware UG.
This is an NGO? What is this?
One day. So for now, we are
it's
just...
an organization?
Yes.
Okay. You said
we're not registered, Mindful Conversations, but for now, we are just a forum. We create as much awareness as we can on mental health issues.
How do I find you?
So we are on social media. We have Twitter and Instagram, which is at Mentally Aware UG. We are also, you can also reach out to me personally on my social media, Hazel _Muliro.
Underscore?
Muliro, Muriro. Okay. There are other resources, for instance, the Mind Lab. It's this beautiful collective of us mental health professionals started by Liz Kakoza. She's a mental health activist, and I think she's also living well with a mental illness.
Oh, she has one?
Yes.
Okay, that's good. That's a good one to talk to.
Exactly. So she has started the Mind Lab, which is just a space for us psychologists to know each other, to help each other, to refer patients to each other in case we're too busy. You can reach out to them. We have Conquer UG, which is founded by Brenda Iriama, lovely woman. She also has a team of mental health professionals she works with. They're also on social media. As we now know, everyone, most people now have smartphones. Yeah. There is Heart to Heart Spaces, founded by Rita Auma, mental health advocate, lawyer, and also living well with a mental illness. Love her. You can also, again, I encourage people that if you can't find these specific resources, Google is your friend. Believe me, if you enter mental health
in Uganda,
people will come up. Again, one of the top people who will come up, Dr. Elizabeth Mosoke, my bestie.
Yeah, you mentioned.
Yeah, there are other mental health resources. You can also go to a clinic. Like I said, nowadays, if you pay attention, they now provide those services.
If you search, you'll find it.
When you walk to your health center, I bet you on the notice board there is something there saying counseling available on Thursday, on this day, from this time to this time.
We've always been seeing this ever since we were young, but it would always be who goes there?
I would encourage people to go. And also, if we ask, that's the other thing. If at the health centers and the clinics, no one ever asks for the help, then people think maybe there's somewhere they are going. And for this section in our clinic is taking up space and resources for no reason, and they close it. And yet someone has to go farther than they have to get help. So ask. If they don't have, but at least you ask, they will also bring it up to their superiors or to administration in the hospital. You know what? People keep asking for counselors. We never counselor. We need to bring these services. Yeah. We need to normalize the conversation on mental health and mental illness. Yeah. and to ask and to ask and to demand. That's another thing. As you ask, also demand, because health is a fundamental right.
Oh, yeah.
Yeah.
So finally, before we close, is there any specific information you'd like to give out to the listeners in accordance to maybe PTSD, as we have just discussed, or general mental health?
Yes.
Is there any message that you'd like for the listeners to get from you, Hazel? Hazel says this.
So I have two things I would love to stress.
Yes.
I would love to stress that mental illness or feeling mentally unwell, it's not something that describes your character. It has nothing to do with your personhood or to affect who you are. It's just a sickness, much like physical sickness. It's being sick. I'd love to stress that our brains, our minds are part of our bodies, and they're going to get sick one way or another. It's unavoidable. And just because the conversation is not normalized, people don't talk about it, doesn't mean it's not there. I would also love to encourage anyone who is struggling with their mental health to reach out to any mental health professional you know or have heard of. Please don't give in to society pressure that, why would you see Oli
Feel
Mulalu?
out of place,
It's perfectly normal to feel unwell.
And you're not the first.
And you're not the first, and you're
Neither
not the
will
last.
you be the last.
Yes. Another thing I'd love to encourage people is please don't diagnose yourself. Then please don't focus too much on what's being shown on film or in the media. These people are following a certain storyline, or there's something that they're trying to portray in the film, and that doesn't mean that's what's going to happen to you. Always remember that that's just a movie. Yes.
The extract of the
Yes,
entertainment.
media does
entertainment
affect
value.
very much how people perceive illness, even physical illness.
Because for them, they're only looking to entertain.
Yes,
They
and
pick
they're
out the
looking to
extreme-
portray that story,
the
to
extreme
stay
versions of
authentic
it.
to
Yes,
that
yes,
story.
yes.
But that story doesn't mean that's how everyone else is or suffers. And I would just love to encourage people to look after not just their bodies but their minds. There's so many ways that you can look after your mind.
How?
Very many ways. We can incorporate
If
different
exercise,
tips
should I
and
what?
yes,
Should I-
yes. There are
It
very
works?
many things we can incorporate in our day-to-day life that help us live healthy lives, not just physically but mentally. So exercise is a lovely way. Yoga, meditating, journaling, eating healthy.
Very
you know.
hard. It takes a lot of money to.
Oh,
eat
but
well.
no, but for us, we are fortunate. We are in Uganda.
Oh, yeah.
Eating well,
Natural.
the kachumbari, and
Kachumbari.
those tomatoes for 500 and tungulu wa
Well, I don't
bisatu.
know anymore. It was at one point, but I think now
But-
you get about 4 for 1,000.
But those are enough for you for lunch with kachumbari, and then
But I have a family, so
Of-
that's times.
yes.
Anyway, but I think that. the
Yeah,
point is,
there are very many things we can incorporate in our day-to-day life that can really, really help and benefit our mental well-being. I would encourage people to really look after themselves, even in the most tiny ways. I think it's not normalized in our culture for people to kwefako. I think if
Kwefako kutomi.
people have this thing of mnange wefako, and it sounds
It's
derogatory,
it's like you shouldn't.
you know, how can you be there ogenze mu spa, ogenze mu sauna?
It's
Me, I waste
it's
time.
huge
Yeah,
to
I
be
waste
doing such
time
kind of
in.
things.
Yes, I think we should normalize
Or you just
looking
can't stand in the
ourselves.
sun.
We should
Maybe-
normalize that.
maybe
You know,
that's
if you
it.
have your car 100,000, if you're bored with Kampala Bala, if you can get a taxi 6,000 to Jinja, ogenda Komazi. That's part of self-care. You know, you reset. You see how people in Jinja are living, and you come back. Yeah.
Change of environment is also good.
Exactly. There are very many things we can incorporate in our day-to-day life that are good for our well-being, our mental well-being, and I would encourage you to do them and to try them. I
Only
would-
limited by your research.
Yes,
thing
I
that you
would
can
also
do.
encourage people to maybe indulge less in alcohol. We have a serious alcoholism problem in this
Because
country,
it's a good escape.
but it's not good for you.
It's-
Again, it's
because
not
it
bad,
brings a
but it's a
frenzy.
slippery slope. Because it starts with every weekend I hang out with the boys, we catch up, we talk about our work weeks, we drink, but it's a slippery slope. It could easily stop from being Friday to Sunday, and it's now every night. You guys have to go to the bar. You know, it reaches a point where, you know what, you have withdrawal symptoms every morning, or kankana if you don't put
Those are
something
withdrawal
there.
symptoms. When
Yes.
the body is coming back to its normal.
When you wake up and the alcohol is out of the body, because now you're on that slippery slope
What
of
they call the
alcoholism.
hangover.
A hangover is a manifestation that you took more than you could handle, and that is treated, and that is over and done with. But there are people who get to the point where they need alcohol to function, and it's
once they wake up.
exhibiting themselves. It's exhibiting itself in their physical traits. They are shaking, They need to take a coffee or to take another drink,
Something to spike
just
up the
just
blood,
to
yeah.
spike up the blood, and so we need to be careful with using alcohol as a tool to cope. It's very, very. I personally wouldn't encourage someone to do it, but I understand how someone would feel,
Why someone would do it.
why someone would engage in alcohol as something for procreation and just to cope. Because I do it. I am a wine enthusiast. It's so intriguing to me how different wines taste, completely different.
Nice.
Like, it's so intriguing for me to.
I wouldn't tell.
Yeah, it's
Anything
so fun.
red would
Exactly.
taste the same.
I know the grapes. I know the regions. It's so interesting to me. I like to understand, why are they saying this is a good year? It's because of the climate. So the soil was perfect that year, and the climate was perfect that year. So that's why they'll
that
say
came out of it.
this Cabernet Sauvignon 2019 is a good year.
Oh, that's why.
Yeah, so those things intrigue
interesting.
me in a sense of learning them, but it's a slippery slope. It could stop being intriguing to me, and now I'm just
Actually,
drinking
it's
for the
history
sake of
writing,
drinking.
But then you'd have to go back and find out what happened in 19. People probably spent a lot of time at home, and they did more gardening, and there was
Yeah.
good weather.
Exactly.
Interesting.
Yeah. So there's so many ways. I would also encourage you to use Google. I mean, we're so good at laughing at memes on the internet. Once in a while,
Mostly we look for movies.
yeah,
or
once in a while, make a research.
Make a research.
Hey, why don't you make a research?
Okay, Dr. Hazel, I think that's all the time we had today. Thank you for taking out some of your time, and you came here to discuss some of these things that are mostly affecting our society, and people don't know so much about the things we've said. So I hope the listeners out there pick one or two things from this conversation.
I hope so
and,
too.
to help themselves become better people.
Yeah.
Okay, so thank you. We'll see you again here some other time.
Yeah, invite me. Where there is wine, I'm here.
Okay.
Thank you. Wishing you and your loved ones good health.
It numbs you, a nightmare, a horrible disease. These are just a few of the ways people have described mental illness in their lives, whether it's you, your child, or a friend. Mental illness impacts all of us in the same ways, and that's why the Mind Space podcast is committed to uncovering mental illness and the impact it has.